Multiple studies have found 10 to 15% of physicians are at risk for problematic alcohol abuse and dependence. In 2 large national studies of U.S. physicians involving over 14,000 physicians, 15% had audit scores consistent with alcohol abuse or dependence. The prevalence of alcohol abuse or dependence in both these studies was higher among women physicians than male physicians. And the findings suggest physicians suffer from alcohol use disorders at a rate equal to or slightly higher than counterparts in the general population, where the prevalence is around 12.6%. The use of other substances is uncommon among physicians. However, physicians are more likely than the general population to abuse prescribed opioids and benzodiazepines. Now, there are multiple factors contributing to why physicians are using alcohol and other substances. Often, it's to self-medicate. We know that physicians with burnout and depression, physicians who struggle with work-life integration, have a substantial amount of debt, and interpersonal relationship problems are more likely to have at-risk drinking, substance abuse, and dependence. Alcohol abuse and dependence can have many ramifications, both personal and professional. Problematic alcohol use can result in suspension of your medical license, and in most states, if you get a DUI or DWI, you have to notify the medical board within 30 days. This can lead to increased scrutiny and a sense of one's public image being damaged. For some physicians, feelings of incompetence and perceptions of stigma result in them choosing to leave the practice of medicine. We know that physicians who have alcohol abuse or dependency trouble are more likely to perceive that they have committed a major medical error. Furthermore, alcohol is well known to increase impulsivity, and among those with suicidal ideation, there is an increased risk of moving from idea to action. For those feeling distressed, it is even more important to get help for alcohol use. If you are feeling distressed or suicidal, please take a look at the tab for emotional health and suicidal ideation and get help. For those of you who choose to drink alcohol, the 2010 Dietary Guidelines for Americans recommend you only do so in moderation. And this means 1 drink for women and no more than 2 drinks a day for men. It's important to remember that substance abuse is treatable and it is reversible. Physicians actually have an excellent prognosis when the problem is identified early and appropriate interventions are started with treatment and monitoring. Relapse rates for physicians is actually lower than that of the general population, and physicians can safely return to practice after they have engaged in treatment. It's important to start off with a good trajectory by establishing safe practices today. Do not use substances as a coping strategy for stress, and if others express concern about your alcohol use, please listen. Volunteer for treatment. I encourage you to explore other sections on the resource page pertaining to alcohol and substance use. You'll find phone numbers for local resources at your center, including support staff who might be able to meet with you individually. There are also links to national resources and publications providing additional information on the topic that might be helpful.